All right, well, it's noon, so we're going to go ahead and get started. On behalf of the University of Iowa Hospitals and Clinics, we want to thank you for attending today's presentation with Dr. Pawlak. Our faculty's goal is to share information that you can use about the latest therapies and techniques in medicine and answer your questions about how to partner with us in the care of your patients. These are informational presentations to enhance your clinical practices and to provide you with the most updated information that we have, in particular regarding COVID in this time right now for this presentation. Right now I want to introduce Dr. Pawlak. She is the director of the Women's Wellness and Counseling Service. She's a health psychologist for the Center of Advanced Reproductive Care and clinical assistant professor through the Department of Psychiatry, Obstetrics and Gynecology, and Psychological and Quantitative Foundations. So you have a lot of credentials right there. We really thank you for joining us today and presenting your most updated information and sharing it with people in this, like everybody keeps saying, unprecedented time. So at this time, Dr. Pawlak, I'm going to turn it over to you. I also did want to remind everybody on this presentation today that we really encourage questions and interaction. At the bottom of the screen, you have a chat function where you can type in a question. You can also unmute yourself and ask directly as well. So we encourage questions probably at the end, unless you have a very pressing one as we go. Otherwise, we'll be open to that at the very end. So on that, Dr. Pawlak, we'll turn it over to you.
Okay, thank you, Randy. I'm really glad to be here today. I can't see any of you, but I'm hopeful that you enjoy this presentation, that you learn something from it. My goals are really to share with you information that will be relevant to the patients that you're dealing with who are coping with both infertility and the COVID-19 pandemic that we're all coping with right now. I also hope to give you some skills and some tips in helping your patients cope with both their infertility and with the pandemic, which adds layers of stress that would be hard to even imagine until we're actually experiencing it like we are now. So my thought was to kind of think about the questions that you might be thinking of, the things that might be troubling you as you're dealing with patients at this time who are infertile. My first question is, how can I really help my patients who are coping with this pandemic? So how can you help your infertile patients? What's interesting right now is there are many parallels between what our infertile patients have always been dealing with, the stressors that they cope with, and the current coronavirus pandemic. We know that infertility brings a sense of isolation. It causes people to feel different from everybody else, to feel different from those who can bear children without stressors, the people who are fertile. A lot of times, infertile patients will isolate themselves. They may feel isolated and further withdraw from others, feeling a sense of separation between themselves and their fertile counterparts, friends and neighbors and family members, coworkers. I'll have patients describe to me sort of withdrawing at work when there's people talking about having babies or being pregnant, maybe avoiding baby showers or things like that. So a real sense of being separate and apart from others. And as we know with the current pandemic, we are being encouraged, if not mandated, to isolate ourselves from others. So this further exacerbates this sense of isolation and separateness from other people. And this is going to be, so it's an even greater burden for our infertile patients right now. Also fear about the future. That's something that really marks infertility. There's always a sense of what's going to happen. Will my treatments be successful? Will I conceive? Will I have a healthy child? What if I have to live with childlessness? So this fear about the future is always there. And similarly with the current pandemic, that is how all of us are feeling. We don't know when things will get better. We have fear about our own illness, our health, the health of our loved ones. So a lot of fear about the future there as well. So then again, a double burden for our infertile patients. Also, barriers to care. Here's another issue that has a double meaning for our infertile patients. We know that there are often financial issues that prevent our infertile patients from getting the care that they would prefer to have, if any care at all sometimes. Biological issues, their own body, health concerns, not doing what they want it to do, what they imagine their body would do. Similarly, during this pandemic, people are facing immense financial issues, loss of job, loss of wages, all sorts of things like that, and concerns about biological issues, about illness. So as you can see, as we all cope with this pandemic and have these concerns that come up, our infertile patients have almost, like I said, a double burden of these same issues. So we know that infertility leads to stress. And we know that stress often leads to symptoms, including grief, anxiety, and depression. And then we have this pandemic dropping in down on top of all these things, exacerbating the weight or the burden of all these issues that were already there prior to the pandemic. We know that in times of fear and uncertainty, grief, anxiety, and depression are exacerbated. They become deeper. And also, as we all know, our routines are disrupted right now. Our sense of normalcy is not there. Everything feels different and unknown. And those deep levels of uncertainty and loss of normalcy and loss of routine, which previously were comforting, it's comforting to have something that we know is always going to be there. We get out of bed, we get ready, we go to work, those sorts of things. When those are gone, it causes a very significant sense of distress and loss. Now, when our infertile patients were able to receive care, a lot of times we talk about, I talk with patients about the idea that you have a plan, you're moving forward with care. That's something to hold on to. That gives them a sense of reassurance, a sense of agency. I have something that is moving forward here. Right now, as we all know, most fertility treatments are on pause, postponed, halted due to the coronavirus pandemic. And that's extremely distressing for our patients who now have lost even that sense of, at least we're moving forward with my treatment. They no longer have that. So that's extremely distressing for them. It brings a greater sense of powerlessness and loss of control. And again, it compounds all those things that they were already feeling, that grief, anxiety, and depression and stress that was already going on. So I want to talk a little bit about some of the strategies that you can use when you're helping your patients cope both with infertility and with the current pandemic going on. My first note is remind your patients that you are there for them and that you will restart treatment once it's been deemed safe to do so. Listening to them is the next kind of strategy. And this sounds easy to do, but most of us are better talkers than we are listeners. And sometimes when we listen, we don't actually hear what people are saying. We hear what we think they're saying or what we want them to say. So sometimes when we're listening to people who are struggling, it's easy to feel defensive, especially if we feel like they're sort of blaming us. How come I can't move forward with my treatment? When are you going to tell me that I can come back for IVF? Why can't your clinic move forward? This is an essential healthcare treatment. It feels like we're being blamed. And so most people's first inclination when they feel blamed is to get defensive. We don't want to do that here. We really want to listen to what our patients are saying. We also don't want to listen and judge people. It's easy to say, and my own patients will say this, I shouldn't be so distressed about my infertility care not moving forward. I do have, a home, I have food in my home, I'm healthy right now. So kind of dismissing those fears and concerns or judging them as not relevant or minimizing them, that you should be happy that at least you're okay. That's not necessarily helpful for us to do with our patients right now. We have to take them where they are, listen to their concerns, and not, again, blame or judge them for having those concerns. And finally, we want to help our patients to engage in healthy behaviors. In times of stress, our thoughts tend to sort of spiral and not in a good way, in negative ways. We want to help our patients to stop that unhealthy negative thought spiral. We want to help them to engage in healthy behaviors. Some of these behaviors will be ones that they can use, they've been using, say, all the time. Others will be modified due to the pandemic. So your next question might be, what are those behaviors that I can recommend to my patients? What kinds of things do I want to tell them to do? Was there a question? No? Okay, I'll keep going. So this word cloud was created using a lot of different words that come to mind when we think of self-care. So I'm going to kind of talk about a few of these, but think in your own mind, what are the things that you do or have been doing during this pandemic, or really maybe at any point in time, that have helped you to relax, to de-stress, to feel comfort? These are the same sorts of things we're going to recommend to our patients, or remind them to do again if they've already been doing. We want to think about basic self-care actions and activities. Some of these things are going to be, one of the major things I mention to people at all times is seeking social support. Right now, that is definitely more challenging to do. We all know that we are supposed to be social distancing. We can't just go out, meet a friend for lunch, or talk over drinks, or engage in sort of in-person games or sporting activities, things like that. So a lot of the avenues that we may have previously used for social support are not available to us. But that doesn't mean that we can't still reach out in other ways. And at this point in time, in order to combat that isolation that we're all feeling, that I talked about at the beginning, that's exacerbated for our infertile patients, we have to encourage them to reach out for support from others. So that's a really important and specific one. And another one is just physical activity. This is something that I recommend to everyone. It has proven mood benefits. In fact, physical activity rivals psychotherapy, rivals medication even, in terms of its effectiveness in improving mood and coping strategies. So it's a wonderful thing. And most people think, well, does that mean I need to run a marathon? It does not. It just simply means sometimes getting outside and moving. That can be, right now, obviously, again, we have some limits and barriers to what we can do for exercise. We can't go to the gym. So people are maybe working out at home or taking a walk around the block, but some way to get out and get some movement. Eating healthfully is another thing to practice. Right now, when we're at home, maybe a good bit of the time, better access to our fridge and our pantry, which may be a lot of unhealthy snacks, which I know as well, I'm partaking in those things. So we want to encourage our patients to eat healthfully if they can. Remember to eat. Sometimes when we're anxious or depressed, we don't eat. That's not healthy either. So excess snacking or not eating at all. So again, this is good self-care. Mindfulness is something that is very important to do. And I know there's lots of different definitions about what mindfulness is or what it looks like. And you can kind of define it in different ways. When I think about it, to me, it's living in the present. So it's not thinking about the past, like, oh, if only we had started our IVF before this pandemic started, maybe we'd be at a different place. Or what if I started family building earlier in my life? That's past. It's not future either. It's not saying, What if this thing never ends? What if I get sick? What if I can't have a child? It's not that. It's thinking right here and now. How do I feel? What's going on in my body? What's going on in my world? One of the things that I will say to someone when I'm trying to encourage mindfulness is, what do you know to be true right now? What do you know to be good in your life or stable, not changing right here and now? So that's when I think of mindfulness, or I think of present focus strategies. That's what I encourage my patients to think about. Those things may include, I am breathing right now. I am alive. Very simple things. I have my family in my home and my family is safe. I have food in my cupboard. I have a car to drive if I need to get somewhere. Very, very basic things that are true and bring us to the moment and bring gratitude. Other things that are important to do in terms of self-care, anything you could imagine, reading, catching up on TV shows, video games. I've heard people say that they're doing a lot more kind of gaming, getting outside, gardening. I've had a patient say that she's taken up knitting, making a scarf, something like that. So sorts of things that kind of maybe keep our hands busy and our mind occupied, but not in an extremely stressful or arousing way, but something that might be pleasurable or distracting. And also getting enough sleep. Right now, people talk about having lots of vivid dreams or having difficulty getting to sleep. Our patients who are infertile may have already had stressful sleep issues. So really encouraging when we can good sleep. And some of the mindfulness strategies are ones that can help you get to sleep, like deep breathing and things like that as well. So there are certain activities that might be particularly relevant for our infertile patients right now in and among all these self-care options. When I talk with patients, a lot of times I will say, what are the things you can control? You cannot necessarily control your treatment or how it goes. You cannot control your body and make it conceive, but you can control your physical and emotional well-being. So staying physically active, staying as calm and centered as you can, these are things that you can work on that will have a positive impact. And another thing that's specific to our infertile patients as a self-care strategy is that seeking of support, especially from other individuals who have experienced infertility. So, and as we go a little bit farther along in this presentation, I will offer you some different resources that you can recommend to your patients that will be specific to infertility support. So right now, most of our infertile patients usually feel like people don't quite understand who aren't infertile. Now that's simply exacerbated. So this is a very specific self-care strategy that you can recommend to your patients right now during this pandemic to reach out to others who have similar infertile issues going on and are coping with that way. Okay, so my next question is, we talked a little bit about this, and we said people might be blaming right now, but why do some of my infertile patients seem so angry? So what we want to remember here is that when anybody is experiencing prolonged stress, which we all are right now, and stress that doesn't necessarily have an end point, that leads to an intensification of negative feelings. So we all can sort of bear a burden for a short length of time, especially when we know that when that burden will end or when that weight will be lifted. But right now, none of us kind of have any sort of idea or any accurate prediction about when this pandemic will end and when fertility care can restart again, which is extremely stressful. So when you have that prolonged stress with no endpoint in sight, you begin to lose the ability to kind of keep your negative feelings in. So people are describing to me feeling very irritable, very easy to anger. They have just a very kind of short fuse. And it's sort of like when you're sleep deprived. If you think about when you don't get enough sleep, you can't function very well, you can't focus, you can't sort of keep it together emotionally or sometimes even physically. And so that's kind of what's going on right here. And when we talked earlier and I said, people are experiencing fear, sadness, grief, anxiety, we imagine how these emotions are going to look. We imagine someone who's depressed is tearful. We imagine someone who is anxious will sort of be kind of shaky or kind of uptight. But really, anger is often how these feelings manifest. This is actually how they look. So anger is the manifestation of some of these fears or sadness or anxiety. So how do you cope with these fears? Maybe you have some of these yourself. You're feeling kind of irritable and angry, but what about your patients, your infertile patients who are feeling like that? So empathy is really the strategy that's going to help in this situation. Just like I mentioned to you, you need to listen, you need to understand. That's what empathy is about. Empathy is a difficult skill. It really is the ability to step into someone else's shoes and to understand how they're feeling, to look at the world through their eyes, which can be very difficult to do. We're all experiencing our own difficulties right now, our own stresses, our own fears. So it's not necessarily the easiest thing to do, but it's the thing that's going to be most helpful for our patients and also for ourselves, showing ourselves some empathy as well. So what we want to think about with our infertile patients is right now, with treatments being postponed and on hold, they are feeling this enormous weight of what's going to happen. Short term, when will treatments begin again? Long term, however, what if it's too late when we return to treatment? And what if I won't be able to have a child? For most of us, not for everybody, but for most people, family building is sort of almost an instinctual drive. It's something that we think about even as young children. I look forward to being a mom or dad one day. So that's the same for infertile patients, and they've had multiple barriers and losses along the way on that journey to parenthood. So this is a huge, immense barrier that's been put in place. And so when we're trying to be empathic with our patients, that's the biggest thing I want you to remember, that they may think right now, I may never have a child because of this pandemic. And that's a fear that is almost overwhelming for many people. So again, empathy is something that we really need to practice. So I talked a little bit about grief, and grief is huge right now. It's something that not a lot of people are putting their finger on, but I can see it in the people I'm dealing with. I can see that sense of loss and fear, sometimes paralysis, and that's all grief and loss. So let's think a little bit about some of the losses and fears and kind of contrast and compare between infertility and coronavirus. So our infertile patients obviously have, loss of good health, loss of an identity as a healthy person. They have been diagnosed with the medical disease of infertility, and their identity as a healthy person, a childbearing person, has been taken away. So there's those losses. There is the loss of those children that they hope for, maybe in the way that they hope to conceive. A lot of my patients will say to me, I really hope and believe that one day I'll have a child, but it's not going to look the way I wanted it to look. It's fraught with so much time and energy and resources. I never thought it was going to be like this. It shouldn't be like this. So this loss is very salient and tangible. A lot of our infertile patients have experienced pregnancy loss, treatment failure. Those are huge losses that all bring with them a sense of grief. And for some of our patients who are coupled, who have a partner, there's a fear that this stressor, their infertility, may damage or perhaps even end the relationship with their partner. So those are all sort of huge burdens and stressors and a sense of loss that our infertile patients experience just in general due to their infertility. In terms of the current coronavirus, we all can relate to these fears and losses. A fear of the illness itself, a fear of just stepping outside and getting too close to someone and getting this illness that nobody seems to have a good handle on. Nobody truly knows how to treat it effectively. And it's very frightening, and it brings a sense of grief. So a fear of that illness, a fear of your own loss of health, fear of your loved ones, or even just people you associate with becoming ill and perhaps dying. We talked about the loss of normalcy and the loss of routine. Again, huge in causing a grief reaction. Loss of job, financial losses. We talked about these as well as huge losses and fears here. And so what we want to think about, so what do we do about this? Now, grief is not something that we can solve. I work with a lot of patients who are grieving both infertility, pregnancy loss of children, and it's very hard because our first inclination as someone who cares or who's around someone who's grieving is to try to solve that grief, to try and take it away as quickly as we can. And in trying to solve it, that's sometimes when we stumble. And it's not particularly helpful to try and solve that grief because really we can't. We may want to say, hey, look at the silver lining here, or you'll have a child one day. I know it'll happen, but we don't know that. We don't know what the future is going to look like. We don't know any better than our patients do. So we can't sort of take away that grief. But what I do want you to encourage you to do is to listen to them and offer a caring attitude. To be there with someone in their grief is sometimes all that we need to do. It's hard to remember that, but that's it. Having someone there is sometimes the biggest support that anyone would ever need. So asking someone, how are you feeling? Sometimes that's the only thing we need to do in circumstances where grief is predominating. Okay, so I'm nearing the end, and my final piece of information for you is going to be some resources that you can suggest to your patients. There's lots of good things kind of floating out there in the world right now, lots of ideas and resources to help people cope with the pandemic. The resources I'm going to provide you will not only be helpful for people coping with the pandemic, but also specifically for our infertile patients who have, like I said multiple times now, a double layer of burden and weight on top of them. So my first suggestion is going to be Resolve, which is the National Infertility Association. Resolve is a very important agency. In fact, this week, I think National Infertility Awareness Week, which is sponsored by Resolve, began on the 19th. So it sort of got lost in the shuffle of the pandemic, and nobody's sort of doing a whole lot to celebrate it because we really can't. But Resolve runs that every year, and it's a wonderful acknowledgement of the stresses of infertility and the hope that we have. So Resolve has some great online support groups. Normally they run in-person groups, and they're really fantastic, and there's lots in many areas of our state. Right now they're not meeting in person, but they've switched to online. So this is a great option to provide to your patients, is suggest that they join one of those online supports. There's also a directory of professionals. So people like me, and other professionals as well, doctors and things like that, that are members of Resolve that patients can be referred to. Secondly, the American Society for Reproductive Medicine, also called ASRM, has come up with some very excellent resources and suggestions for patients, specifically our infertile patients who are both dealing with infertility and with the coronavirus. And finally, I'm a member of the mental health professional group for ASRM. And so my group has come up with some really good mental health care resources, some of the same things that I've kind of mentioned today, plus many more, as well as there's also a directory of mental health professionals there. And right now, a lot of mental health professionals are providing telehealth services, so that is something you can recommend to patients. Not everybody, but for instance, right now I'm providing care solely via phone and video appointments. So there are people across our state like me who are able to do that. So you definitely can look and kind of look at for resources and recommend these to your patients. So anyway, so my presentation is complete. Thank you for listening, and I'm able to take questions.
Dr. Pawlak, how often do you recommend keeping in contact with your patients during this time?
So that's a good question. And I think it might depend a little bit on the time that you have. I think that any time you reach out to your patients, it's going to be very much appreciated and very important to them. Right now, all of us are extremely busy, doing lots of different things, caring for ourselves and our family, as well as probably working remotely or working on site, trying to manage this new world. So it might be hard to find the time to reach out to your patients. I think that it can be as simple as, like I said, thinking of you, or if you have questions, message me. I've been, as a mental health care professional, reaching out a little bit more often to people, and I've been offering them the idea of if you need something before we meet again, don't hesitate to reach out. I found that most people don't overutilize that. There may be some people who might be anxiously reaching out too often, but most people are conscious of the fact that we have things going on too. So a lot of times my patients, unless they really need something, they're not reaching out right away. So frequency is really going to depend on your availability, but I would suggest, maybe like I said, reaching out once and saying, let me know if you need anything. That way that puts the sort of the onus on the patient to kind of reach out if they have a question or a concern. And I've actually encouraged a few of my patients who have had questions that I couldn't answer about their infertility care. I've said, just send a brief note and say, any updates? And that sort of doesn't put their provider on the spot, but necessarily it might be able to respond, no updates now, but I can let you know if something comes up. So.
Great, thank you.
Mm-hmm.
Hey, Stacey, it's Michelle.
Hey, Michelle.
Do you have any words or statements that maybe we can use when the patients say, but this is a medical emergency, or this is essential treatment? And what kinds of things could you share with us maybe that we could help share with them?
Yeah, that's a hard one, because you're right. A lot of patients do view this as essential care. As we talked about, it's family building. To them, that is vital. That is part of their life. That's their future. They need to do that. I think that, again, my suggestion in that moment I want to give you some things to say, but I also want to say at that point I would suggest saying that it sounds like that is extremely stressful to imagine not moving forward with care. To reflect back a little bit first and that'll give you a moment too to think about how you want to respond. That's what I always do if I'm stuck with how am I going to answer that one. I reflect back what the person is saying. It sounds like you're really feeling overwhelmed with this, or you're really worried. So start with that. I think right now, there's not a whole lot we can say to that. We have to be honest and say, unfortunately, there are many, and ASRM does have some talking points on this. So there would be, and I don't have them in front of me right now, but they've offered a few talking points to our patients. But kind of understanding that because of protective equipment, shortages of that. Many forms of medical care right now are being postponed. Treatments that are not life prolonging, or people who are not in immediate need of something that will save their life or prevent disease progression, are also being postponed. Those treatments are. So explaining the rationale, that may not necessarily feel good to our patients, but maybe it helps them to understand you haven't been singled out. There's these other types of care that's being postponed as well. And this is kind of the reason why we don't have enough equipment to be able to provide your care safely. And we're having to focus that use of care on the people who are actually suffering from the coronavirus, unfortunately. So there's not a great solution there. Again, I would suggest people kind of know some of this too, and it's more a sense of, I feel no power, I don't know what to do, change this for me, and we can't change it for them. We can say, gosh, it must feel terrible. It's just like with grief, when someone says, I feel, terrible, help me to end this grief. And I'd love to say, oh, I can end it right now. We can't. We can just say, oh, it must feel really terrible. I'm so sorry that you're experiencing this. That will go a long way. So.
All right, are there any other questions for Dr. Pawlak? Okay, well, we want to thank you guys for joining us today, and definitely thank Dr. Pawlak for presenting this and adding a little comfort into our day as well. I think we all benefited from that, and also how you can help your patients. We have recorded this presentation, and we will post this to our referring providers educational page where you registered, and then also in a follow-up with all who attended today. And in the meantime, if you guys have more questions, feel free to reach out to us or Dr. Pawlak. We can get you in touch with her. And we also have other upcoming presentations, so please, we encourage you to register for those as well. Other than that, we want to wish you a good day, enjoy some sunshine, and thank you for attending.
Thank you.